Good morning. Wasn't so good of a morning. Good morning. That's good. The board meeting of the North Carolina Board of Nursing will now convene. We do have a quorum for the meeting. This meeting is being recorded for record purposes. Moving on to the Ethics Awareness and Conflict of Interest reminder, in accordance with the State Ethics Act and the Code of Conduct for members of the North Carolina Board of Nursing, it is the duty of every member to avoid both conflicts of interest and appearances of conflict. Does any member have any known conflict of interest or appearance of conflict with respect to any matters coming before the board today? If so, please identify the conflict or appearance of conflict and refrain from any undue participation in the particular matter involved. Seeing none, welcome again, all board members, and welcome also to our guests who are observing today in the office and through our public link. We have Brian Miller, our videographer, capturing footage for an upcoming video staff are developing. Also, welcome, staff. The board's mission, vision, values drive our work as a board and serve as a reminder to us as we carry out our business. The mission, vision, and values are posted on the board's website for reference. Are there any announcements at this time? Seeing none, we will now move to item M4, our additions, modifications, or reordering of our agenda if needed. Are there any additions, modifications, or reordering requested at this time? Okay. Seeing none, do I have a motion regarding adoption of the consent agenda? Thank you, Dr. Bartlett. Dr. Bartlett has made a motion to adopt the consent agenda. Do I have a second? Thank you. Ms. Diane Layton has seconded the motion. I will now call for a vote. All in favor by show of hands. The vote is unanimous. It carries. Do I have a motion? Moving on to agenda item M6, adoption of the meeting agenda. Do I have a motion regarding adoption of the meeting agenda? Okay, thank you. Ms. Arlene Imes has made a motion to adopt the meeting agenda. Do I have a second? Dr. Henderson has seconded the motion. I will now call for a vote. All in favor by show of hands. The vote is unanimous. It carries. Thank you. The open comment period. Do we have anyone scheduled? Okay. Thank you, Ms. Catherine. We are now, of course, at the open comment period, and the purpose of the open comment period is to provide members of the public an opportunity to share their concerns and offer views and present questions regarding issues that impact nursing and nursing regulation. At this time, we do not have any requests to speak during our open comment period. Therefore, we will move to the next agenda item. Our next agenda item is our Chief Executive Officer, Dr. Crystal Tillman. Thank you, Dr. Tillman.
Great. Thank you, Madam Chair, and welcome to everyone, board members, board staff, and guests. Just wanted to start off, board members, this morning when you came in, you found that you all have a pin that I hope you can proudly wear as a board member. And this is really for your service and the time that you dedicate to the NCBON. And so please wear it proudly. This is certainly a working board. And I think as evidenced by yesterday, most of you had a very long day. So thank you for that. And then for coming back this morning. Also wanted to share with you that we will be getting the monitors like we have here for the other two sides, but there's one piece of equipment that was missing. So I promise you by the September board meeting, the monitors will be for all sides. So just an update there. Also at your place, you notice that we now have the cards that we pass out and share. This is almost like a business card side with our mission and values, our strategic initiatives, and also a larger card. And as we've been doing promotions, talking to the public, we readily use these to share with people and share our mission and our vision. So I always like to start off with our welcome to our new employees. So Dana Price, our nurse investigator, if you can please stand up. Welcome, Dana. We're happy to have you. And then right beside Dana is Donna Culpa, who is our new legal assistant. So welcome, Donna. And we always like to celebrate our board members, board staff when exciting things happen. So I'd just like to congratulate Jennifer Pelletier. She graduated this past weekend from West Carolina University with her MSN, and she also received an Outstanding Nursing Leadership Award. Congratulations, Jennifer. That was some hard work. You know, when people graduate from a big program, I think the first thing you do is say, "Oh, what are you going to do with all your free time now?" And so I think it's going to be taken up with your family, right? And Dr. Terry Ward, oh my, she had this wonderful presentation. And last month we had a mental health first aid day. She is a certified instructor and went through with board staff. We had about 28 staff that participated. It was an absolutely fun day. Learned a lot about mental health, how to help others, how to help colleagues. But what you do not know is that Dr. Ward, oh my goodness, she can sing, she can dance, and just an educator. And so I don't know if it was more interesting to watch Dr. Ward present the material or, you know, learning the material, but she did a fabulous job, and there's a photo of all of us together. So thank you, Dr. Ward, for leading us in that. And as many of you know, we just got over Nurses Week last week. So to all the nurses, I hope you all had a happy Nurses Week. It's always May 6th through the 12th. And Miss Arlene Imes sent me a photo, and she was the Directors of Nurse Excellent Award for 2023. And so Arlene received that. And here is a photo of Arlene with the executive director of the VA in Salisbury, John Melton. And then here is Dr. Griffin and Angie Mathis. They supported a NCBON booth at the Metrolina Council of Nursing Organizations, which was located in Charlotte. They had the privilege to talk to over 300 RNs, LPNs, APRNs. As you can see, they had a booth that they were passing out our new logo, sharing our mission and vision. And this is great because part of our strategic plan, we're trying to be seen over the state to answer questions. We don't want to be seen as a board that just does investigations. Remember, there's other pillars: licensure, education, and practice. So I think it was very helpful for them to attend and have conversations and promote positivity of the NCBON. So thank you all for representing us. Wanted to give out a shout to investigations. They had their largest month ever last month. Angie told me they assigned over 100 cases. So congratulations to Angie and her team. It takes the NCBON an average time from start to finish to process a case is 159 days. And that is incredible. I would say we are much faster than most of the boards out there. So kudos to you all, and your department is growing. So it's that time of year again when we have our elections for new board members. The voting is open from July 1st to August 15th. And so far we have BSN and higher. We have 7 people running for that position. For nurse administrator, we have 5. And for the LPN, we have 2 people running. So we'll be sending out periodic emails and reminders and to vote, and you vote via email. And we'll also be posting reminders on social media. The bulletin will be released in conjunction of when the start of the elections occur. So the NLC, the Nurse Licensure Compact, is growing. So Washington State, they just enacted the NLC. We are now at 40 jurisdictions, which is great. We are certainly the largest compact board in the U.S. The executive director, Paula Meyer, I'm so happy she was able to get this across the finish line before she retired. And certainly, please know that the NLC, they give webinars and they offer for information for students, employers, and for nurses. And we will post all those happenings on our social media. And the next webinar is scheduled for May, and it's what employers need to know. So the next generation NCLEX, the NGN, it started on April the 1st, and NCSBN has reported that so far about 15,000 candidates have tested. And good news is, you know, we really need a quarter's worth of data, but so far they've seen an increase in 2 to 3% increase in the NCLEX pass rates over this time last year. So like I said, we need that quarter to be able to trend the data. And here in North Carolina, our quarter will end at the end of June. And then we can start saying, okay, now we have a quarter's worth of data. Let's take it, let's trend it, and let's move on from there. But that is exciting news. So I'm pleased to hear that the NGN is going well. I always like to keep up with your licensure statistics, which is posted live at the homepage on our website. Just scroll all the way down. We remain at over 177,000 nurses, and that includes LPNs and licensed RNs. And of course, APRNs are included in that figure since you must be an RN to be an APRN. So our numbers are holding well. When we look at nationwide active RNs, we've got 4.2 million plus, and for LPNs, 920,000 plus. Now, if I had to tell you one buzzword since the last time we met, it is workforce. Everything is about workforce, nursing workforce. So we are trying to get on as many committees as we possibly can because we want to sit at the table to be able to clarify, to be able to promote the board, and to help make decisions. So I am serving on the North Carolina Institute of Medicine for Future of Nursing Workforce. We started in February of this year, and we will have our final report due on April 2024. There's 6 meetings along with individual work groups. And so there are 5 work groups, and I asked if we could have Dr. Moore and Dr. Griffin on as well. But the NCIOM co-chairs, many of you may know Dr. Grant, who's the former ANA president. Well, he is now interim vice dean of DEI at Duke School of Nursing. So I didn't know if you all knew that. So he is still close by and doing great things. Catherine Sevier, she is also the president emeritus of AARP, and then of the director of North Carolina AHEC, Hugh Tilson. He is also co-chairing. It's an excellent committee, and we are diving deep. So I'm serving on the education and career progression. Dr. Griffin is on the equity in nursing, and Dr. Moore is on the 2004 NCIOM task force review. So there's only 2 other ones, payment models and retention work groups. So I'm happy that we're able to sit on at least 3 of the 5 subgroups. So great work that's going to come out of that as well. And like I said, it's just so important for the board to be at the table and hear what's going on. I'm also serving on the Center on the Workforce for Health, which is through AHEC. Dr. Griffith is serving on the North Carolina Future of Nursing Action Coalition. And also, let's see, Dr. Griffith and Stacy Thompson are on the We Care. Now, We Care stands for Workforce Engagement and Care Workers to Assist, Recognize, and Educate. So we can see why We Care is the acronym. And then the Future of Nursing is led by Susan Hassmiller, and certainly that's the future of nursing from 2020 to 2030, and that's certainly national. So as you can see, there's a lot going on with nursing workforce and retention, and just glad to be a part of it. I was also invited to participate in the workforce modeling and healthcare support worker force group in August with NCSBN. So I'm happy to be a part of that. And I've also been invited next month to present at the executive officers meeting to share a bulletin article that we did. We're doing it in two parts, but part one on diversity, equity, inclusivity, the journey of one nursing regulatory board. So I'm delighted that I can share this with all the other boards of nursing across the U.S. and give them ideas of what we have done here in North Carolina and how to help move them forward. Exciting news, we have signed the contract with the Shep Center, and many of you know Dr. Erin Freyer, and her team will create an interactive website looking at APRN workforce. And it's going to be very similar to NurseCast that we had with the RNs and LPNs that we developed. So this is just another step to help us. And, you know, in it, we're going to have the APRNs, the supply and demand model. We'll also look at their graduation diffusion to be able to work with legislators to show them, okay, these APRNs, nurse practitioners or CRNAs, they are truly remaining in the rural areas of North Carolina, and we'll be able to break it down. So I think that will be very helpful to really know where they are practicing and be able to map them out, just like we do with the NurseCast for RNs and LPNs. And certainly the Shep Center's in the data collection. We're at the very beginning, so at the data collection stage. One thing I wanted to go over was some things that the NurseCast pointed out to us, that we were projecting to face a nursing shortage even before the pandemic. So shortages will become more acute as significant numbers of nurses exit the workforce. We found that LPNs are forecast to face even greater shortages than the RNs. Model project shortage of nurse educators. Educator workforce is certainly getting older and at a higher risk of exiting the workforce. North Carolina's nursing programs have different footprints in terms of retention in North Carolina, their local community, and rural areas. We're not going to educate our way out of this shortage. We need to focus on retention. And that's something that we hear Dr. Freyer say over and over again. We have to retain the nurses that you have now. And of course, we're dealing with workplace violence rates that's on the rise. And that too is going to affect the future of our nursing supply. You know, we have such a high turnover at each level. 32% of RNs intend to leave, as reported by McKinsey in 2022. New graduate RNs, 18 to 30% leave within the first year. 34 to 57% leave within 2 years. And at 2 years is the average time that a bedside nurse works in an acute care setting before they leave. So that's a staggering number. So those of you who work at large institutions, I'm sure that you feel the impact of that. So you're happy if you can keep them for 2 years, but our goal, remember, is to retain them and keep them in the workforce. I wanted to highlight our North Carolina nursing education programs, and Dr. Lewis compiled some of the data along with her team. Right now in North Carolina, we have 141 pre-licensure nursing programs. So that's a program before you take the NCLEX that prepares you for your first initial licensure. So when we break that down in North Carolina, we have 36 BSN programs, 62 associate degree in nursing programs, and LPN programs 43. So we know a BSN program generally takes 4 years, an associate degree about 2 years, and an LPN program about a year. So I wanted to share those numbers with you because it certainly increases. Also wanted to share the North Carolina Community College system. We have 56 ADN programs, and we have 39 LPN programs. And then the UNC system, which is our BSN programs, there's 12. Certainly, there are private and independent programs as well to make up the 141. I also asked Dr. Lewis, so, we want to increase enrollment, but where are we at right now with enrollment? How many schools out there are really at their maximum enrollment or within 5 students of being there? So as you can see here, for the BSN, we have 3. Appalachian, UNC Wilmington, and Campbell University. They are at their maximum enrollment. Associate degree programs, Rockingham, Caldwell, Edgecombe, Wilkes, and Bladen. Bladen has an asterisk because they also, not only for their ADN program, but their LPN program, they're at maximum capacity as well. So there's 14 LPN programs that are at maximum enrollment. Rowan Cabarrus, Halifax, Nash, College of Albemarle, Wayne, Richmond, Craven, Forsyth Tech, James Sprunt, Davidson Davie, Wilson, Cleveland, Beaufort, and again, Bladen Community College. So as you can see, the community college system, they are really trying to get nurses out as quickly as possible. So on our homepage on our website, you've seen the banner that says Operation Nightingale. And I know all of you have heard it in the media, in the news. And I'm going to show you a short video, and then I've asked Rob Padgett, our attorney, to kind of give us an update, because Rob is the one that's really handling all these cases, and he really is the best person to update everyone. But we know if you have any concerns about authenticity of a nurse's education, that we ask that you submit a complaint through the NCBON complaints portal, and that way we can investigate it. So now, Brad, if you can share this short video, I thought it would be helpful if some people may have not seen it.
Good afternoon. I am Omar Perez Aybar, the Special Agent in charge of the Office of Inspector General for Health and Human Services. And today's announcement is the culmination of a deliberately measured investigation, aptly named Operation Nightingale. It involved nursing schools in Florida selling fraudulent diplomas and transcripts across the country. The deeply concerning allegations at the center of this investigation goes against the very tenets of the nursing profession. The alleged conduct by these individuals and those who received the fake documents is an affront to Florence Nightingale, the founder of modern nursing standards, the namesake of the world's first nursing school, and for whom the Hippocratic Oath was modified and named the Nightingale Pledge. Now, upon completing their training, nurses pledge to, among other things, abstain from whatever is deleterious and mischievous, and do all that is in their power to maintain and elevate the standard of the profession. The individuals charged today facilitated countless individuals to sully that pledge. Naturally, investigating a scheme involving fake nursing diplomas and transcripts is at the heart of our agency's mission to protect the health and well-being of the American public, especially children and the elderly who benefit from HHS programs, including Medicare and Medicaid. It is true that in this case, we identified several types of healthcare facilities where some of the individuals with these fake documents may be providing services. I want to assure you now that to date, we have not learned of nor uncovered any evidence of patient harm stemming from these individuals potentially providing services to patients. Now, that potential harm to patients is precisely why we've been working with the state licensing boards from the onset of this investigation, sharing as much as we can, as fast as we can, so that they can assess what actions to take to prevent these individuals from rendering care. We encourage anyone with any concerns to contact their state's licensing boards or their healthcare provider. Finally, I want to commend the women and men in the law enforcement agencies represented on this stage. While the work on this case is extremely challenging, your passion and dedication to safeguard the public was evident. On behalf of Ms. Nightingale, I applaud your efforts to protect patients and the integrity of the honorable nursing profession.
At mid-year in March, when we attended, we actually met with the FBI handling our cases in North Carolina. And so I know Meredith, Tony, and myself, we met with them. And it was interesting to meet with the FBI and Department of DHHS and to sit there and talk to them. And they have their, sidearm weapon on them. So yes, so wanted to be sure we were on our best behavior around them. So so that was a lot of fun. So I am going to turn it over to Rob now.
Thank you, Dr. Tillman. Good morning, Madam Chair, members of the board. About I think the day we were here last, that was occurring. I was reading the indictments as they were making that press conference and we were sitting in this room. So a lot has happened since that day. I want to preface this conversation with, I can share some things. They're in the public record. There are other things I can't share because you're my jury pool. And I think there will be a day when you hear some of these cases. So in terms of our investigation, I can give you an update as to where we are. But the specifics of that, we'll leave that for another day. So since that day, that's when they indicted approximately 24, 25 people in this ring. There's about 5 schools involved: Sacred Heart, Siena College, Palm Beach School of Nursing, MedLife West Palm Beach, and Quisqueya, which did business as Sunshine Academy. These schools were operated by a handful of individuals who at one point apparently led legitimate schools. They were approved by the state of Florida. They were operating legitimately. And then at some point decided that they would rather lead a criminal life and started selling fraudulent diplomas and degrees. It was a situation in which they set up a system of recruiters, I'm trying to think who the bursars, the registrars, basically a school system that wasn't a school system. And these individuals, about half of them, maybe just under half, have started to plead guilty to all their charges. That ranges from the owners and operators down to those lower level individuals. And through that cooperation, we're learning more and more about what actually happened. Shortly after we met in January, Mark Van Outen and I went down to Miami to the actual FBI office. When I say that, I got to see the office and never got to go in it. It was a beautiful looking building. If you want to know how glorious it is to be a lawyer sometimes, we went into an unmarked warehouse that turned out to be the strike force office. It was a windowless warehouse filled with thousands and thousands and thousands of documents that they seized in this operation. We had the opportunity, we were the first people who were not federal agents, the first people from any regulatory board to go down there and look at them, which was very helpful in our investigation. We were able to bring back copies of documents that I think will be useful when we prosecute these cases before you. But also it gave us an opportunity to meet with the FBI agents. Again, no one else had really done that before. And we started that relationship, which helped us tremendously as we could reach out to them directly and they helped answer questions for us. I think they've helped obtain additional evidence that will be useful in our prosecutions as well. And I don't think that would have been possible had this board not been supportive and had the resources to send us down. So we do thank you for that. In part because we went down there, I do believe we were able to educate them from a regulatory perspective about what needed to happen. This was a federal criminal investigation, and their mindset was not always on how would we accomplish this at a state regulatory level. So I was able to answer some questions about what we needed, what they needed to look for or provide to help states across the country, not just ours, prosecute these cases. I think one of the outcomes, after conversations with them and other people around the country, National Council helped facilitate copying all those thousands of records and have now made those available electronically. So now every state can go in and look at them and use them as they see fit, which has been a tremendous help. National Council has also facilitated, I think, monthly phone calls with executives, with attorneys, investigators, where we're able to share what we found, our concerns, what's been helpful. And so we're using that information through a collaborative process to further what we do here. So what are we doing here? Well, we've got a handful of individuals that we are looking into that allegedly obtained fraudulent transcripts and diplomas, and then allegedly use those credentials to be licensed by the board. We are taking a proactive but also a cautious approach. It's a complex case because these individuals were not part of the federal indictment. They weren't named by the FBI. These individuals were given to us through cooperation by the individuals that were charged by the FBI. So we're having to create a case against each of these individuals using the scant evidence available to us and the best we can. So we are, I think, in the final stages of what we can do investigatively. We've seen the evidence. In the last month, we've obtained a little bit more evidence that I believe will be the last coming from the FBI. And we're going to try to resolve some of these, if possible, by consent agreements. Others, I'm sure, will end up before you. So I want to caution you as you think about this. I'm sure you've read articles, maybe the indictments. Each case will be about an individual person and what they may or may not have done. We can't assume, based on what you've read, that someone's guilty or not guilty. And don't think that because other states have done things, that means we couldn't do them or haven't done them, aren't willing to do them. It's that other states have other laws and rules that may permit them to take action, take licenses in a way that we can't or choose not to. But we are working towards ensuring that due process is protected, but also doing our duty to protect the public. So I'm willing to entertain questions. I may not answer your questions, but I'm available.
Microphone, please, Mr. DeMarco. Yes.
So help us understand why an individual may come to the board in a legal way when they don't actually have a legal license to practice.
So that's the tricky part, and a complex part of this. They do have a license.
Well, I understand, but they have a fraudulent license.
That's what we'll have to prove to you.
Okay.
That's the complex part of this. So let's turn it around on its head, because I think it's an easier way to think about this. So if you are an individual that's unlicensed and you're an applicant, I think that case in this situation is much easier to make, because they're having to come to you and say, well, I graduated from this school in Florida, but now as board staff, we can say, no, you didn't. We have evidence that these schools issued fraudulent diplomas, and here's all the reasons we know why. I think that's a much easier case to make. The flip side is, at the time these people were licensed, the board was led to believe these diplomas, these transcripts were real and issued a license. They passed the NCLEX. They did everything that every other student does. So now we have to go back and say, here's evidence to prove that what they obtained was fraudulent and that they presented those fraudulent credentials to you. And that's more difficult than the other way around.
Got it. Thank you.
So I have a few questions. So on that note, if they actually did receive their license, the right way, when the schools were operating as regular schools, then that is what you're also investigating as well, right?
So we were provided a list of names that were, again, allegedly obtained degrees from these schools legitimately, and then also a list of names that allegedly obtained them illegitimately.
Got it. Okay. And then about how many individuals are we talking about? You
We
said
have
handful, but
we have 12 that we licensed and are active.
okay.
Yeah.
And then my last question, oh goodness, I forgot my last question. Okay, I'll come back.
So, Mr. Patchett, what sparked, if you're able to share, this whole overall investigation? How did we find out that this was happening?
Well, we were informed, I guess, through the FBI and National Council, but how they were notified, I have no idea.
It actually started in Maryland, and someone had gone to a nursing school and they did not complete successfully. Someone approached them from this underground network and said, you did not finish nursing school, but there is a program that in Florida that you can attend. And so when he heard this, he said, no, this does not sound right. And so he went to the FBI, and the FBI at that point started investigating it, and they had no idea at how large it was going to be. I will tell you that it's mainly in states, northern states, and they're coming down to Florida, New York, Texas, Ohio, Pennsylvania, New Jersey. They all have many applicants that actually came down to attend the Florida school. So that's how it originated.
So when the process starts of trying to, of investigating these individuals, will you and your team secure written statements from them using these Operation Nightingale potential questions? And then let them tell their story? Is that part of the process? How does it work to really uncover what they say they did?
Yeah, I'm going to decline to answer that one.
Understood, thank you.
Spoken like a true attorney, right?
So my question is, how far does this go back? What year did this all start?
Well, the dangerous thing is I think when it goes back to Maryland, it goes back a long way. I think the better part of a decade. And the cases from Maryland to Florida are connected. They're the same. The owners, operators are all connected. It's how they grew their web. I think the one out of Florida is probably 5 to 7 years, but going back to Maryland is longer.
So it looks like in my notes with the FBI, it started February 2019 is when they really actually got involved with the complaint in Maryland. And then folks were paying anywhere from $14,000 with a medical background up to $24,000 if they did not have a medical background, because they were going to need more clinical sessions, if that helps.
Sort of technically, we have had 2 cases already. And I think there's some things we're going to talk about in closed session, if that's okay.
That's going to go into closed session. When you're talking about later in executive session, you're going to request that, or are you wanting to go into closed session now? Okay.
Whatever we go in closed session or any executive session.
Okay. Can we do that?
Let's.
Okay.
Let's talk.
Okay, perfect. Well, thank you, Rob, for your presentation. That was excellent. And then my last slide is on Senate Bill 20. You know, we are monitoring, unless you've been under a rock this past week, you've been hearing about all the going on in North Carolina. I know we're making the top headlines, you know, on some of the media. But anyways, we're monitoring this from the certified nurse midwife perspective, because they have items in the certainly in the bill as well. So I don't want to steal Dr. Moore's thunder. I will let her get into that. But this has been a very busy few weeks. This long session has been busy indeed. So I know sometimes I'll get texts from Dr. Moore late at night, early in the morning, and can I call you? It's, you know, so thank you, keeping us all in the loop. So before we move on to the strategic plan update, any questions that I can answer for anyone? Yes, Dr. Steele.
So thank you, Dr. Tillman. My question was around the retention measures that you mentioned, with workforce. What are some of the conversations that are happening around how to retain nurses, LPNs, and kind of like, research-based or practicum-based
Mhm,
activities that are happening across the nation to
mhm.
retain? I just feel like, there has to be someone who's really starting to fix this or do some great things with this across the nation. So what are you hearing about workforce and retention?
It really is North Carolina Nurses Association, the Nurse and Professional Advocacy. This is what they're really working on, but it's certainly discussed in our workforce groups. It depends on each agency. You may see things, you've probably seen the sign-on bonuses, increase in pay. I know that I've seen one that offers now pet insurance. I mean, it's just the whole gamut of things that are being offered to nurses to help them stay. So I would say it's individual to each agency, but it is across the gamut. But that's part of the work group, is to help identify some things to share with organizations. So I don't know if anyone else has anything that you want to comment on what your organization is doing or any insight. Yes, yes, they are at the table.
I would add, I'm sorry. Go ahead, Frank. I didn't see you. Go ahead.
I know it's at the heat of the moment right now at this point in time, but nursing shortages have been going on for like 30 years. 35 years I've been a nurse. We see this. I think what we need to protect against is, in this scenario, is utilizing unlicensed professionals in different areas within healthcare, not just hospitals, but overall everywhere. Um, because I think there's a risk there for patients and the public if we start to kind of water down the role and responsibilities of nursing because of the shortage. So I think that's one thing we have to be very cognizant of as a board. The other piece is you're starting to see the traveler contract is not sustainable in the country, let alone North Carolina. And so the focus needs to be, how do we manage the cost? Because that's what's shutting units down. That's what's shutting hospitals and also shutting down facilities, because they can't sustain the cost of contracted labor. And so you're starting to see that kind of dwindle now a little bit, which is going to be helpful. But that there are incentives. There's talk about the bonus structures and internal traveler contracts and pools. The LPN group is so essential now, and you're starting to see a lot of people grabbing and gravitating towards, how do we utilize LPNs, which is great because that's what we want to do, right? As a board, we would like to promote LPNs versus unlicensed professionals. So I think that's where we should focus. If that helps, Dr. Steele, that's some thoughts I have.
And just an additional incentive is professional development opportunities. Organizations are offering those.
Good morning. I work for the Salisbury VA, and one of the programs that we're doing for retention, not trying to get rid of our LPNs because I love them to death, but we have just started a program with Rowan Cabarrus Community College on campus. 10 LPNs, they apply and were chosen, and they will be able to do schooling at the VA. They have staff that will be precepting, helping them with their training there, and also doing the schooling at Rowan Cabarrus to help grow our staff.
Just a question. Is the workforce work also focused on reimbursement? Do we know? Because that's really the root of the problem, but I'm not sure that we're attacking the problem. I recently saw something about a commission to look at the reimbursement model for nursing. So I'm just curious if that's part of the work or if that's something that's a little bit separate. Because we can do all of these things and these strategies, but we're always going to come back to cost. And so I'm just curious if reimbursement, changing the reimbursement model for nursing is part of that conversation.
It is in the workforce groups that we're participating in. It's not here in the board as far as our law and rules. We do not get into monetary. Yes.
It is a great point, because when you look at, again, from a hospital setting, you look at radiology, you look at lab, you look at pharmacy, you look at all of these subspecialties within a hospital that bill separately, but yet nursing does not. And so to your point, I think that's something that needs to be looked at. Now, how the board fits into that, I'll leave that up to Dr. Tillman, but there is another component here, and that's, you're going to see this. I believe this is where we'll end up going is nurses are going to be able to go to school for free. And it's going to be sponsored by the private sectors. And they're going to say, you sign on with us for 4 years or 3 years as a nurse at the bedside because you saw the 2 years and they're leaving. But if you sign on to be at the bedside for 4 years, we'll pay for your nursing school. That's already happening with nursing care assistants, LPNs, paramedics, EMTs. And so it's just, and it's starting to happen with nursing. It's just not throughout the country, but it's starting to happen. That's what you're going to see. I believe that's what you're going to see.
So don't we already have the Nursing Scholars Program, which does that here in North Carolina?
Yeah, so yes,
At different
but I think
levels.
what you're going to see is the private sector, that's going to drive this even more. So these organizations, I won't use anyone specific, but a huge health system that has 10,000 nurses positions, they're going to have to do something different, and they're going to have to offer, instead of raising the salary only, that's one strategy, right? They're going to have to do this other piece as well to entice and recruit.
So Frank, I can tell you it's really interesting that you brought that up because about, I would say maybe 10 years ago when I lived in Florida, we actually paid for 150 nurses $30,000 to go to school for free. And because there wasn't a shortage at that time, we brought them all into an auditorium and told them that we couldn't put them into work and they could, they were released from their contract. So to hear this now is startling.
It's very cyclic. I mean, in the 80s, you couldn't get a nurse, you couldn't get a position as a nurse. And then, it just goes back and forth, right? And now you're seeing again, international nursing, right? There's a huge, and we knew about the visas and the struggle with that now and being able to obtain visas for the international nurses that we're trying to attract to the, in our country. So a lot of initiatives.
And one thing that I'm vocal about in the committees, we can't get maximum enrollment in nursing programs if you don't have the nursing faculty. And when you look at the salaries of the nursing faculty in the community college system, it is very low. And so, you say, okay, wait a minute, I am graduating a student that's going to come out and make more money as the, educator. And so that's a real problem. And so people go into education and then they, leave. So, attracting and retaining quality nurse educators is key. So.
And Dr. Tillman, on that note, we now have professor tenure up for a potential change in our UNC systems in our state. So that is an active bill that if tenure is taken away, then you talk about educator quality, educator efficacy, and their retention is going to be in danger because they no longer can qualify for tenure.
Mm-hmm.
And if an educator can't qualify for tenure and he or she is an associate or assistant professor at one of our UNC system schools, then what does that do to retention? So there are a host of issues, but I thank y'all for the robust conversation.
Yes. So I will now turn it over to Dr. Griffin to go over our strategic plan update.
Give me just 1 second to get connected, and hopefully I do everything right as IT told me to do, so I don't mess this up. But I know they're in there hiding, waiting for me to. Brad, it's not turning red. Is it just taking? Oh. No. Thank you. Let me get all situated here. Always can count on IT to help us out when we need it, right? Well, good morning, and thank you, Madam Chair and Dr. Tillman, for this opportunity to present an update on the strategic plan for May 2023. This is an abbreviated update. You have the entire strategic plan update in your packet, but it was requested to, pull some of the key areas out of the strategic plan in a PowerPoint presentation to highlight for you all. So I will start. When planning for the organizational work for the strategic plan, it was identified that we needed a team to accomplish the strategic plan. We have three Achieve It champions, and that is myself, Angela Ellis, and Angie Mathis. And then we also have a strategic plan team, and that's composed of Dr. Catherine Moore, Joyce Winstead, Dr. Jennifer Lewis, Dr. Kimberly Luciana, Hema Parmar, Allison Bailey, Daisha Williams, Meredith Paris, Jenny Davis, and Brad Gibson. And what you'll see from this list from the strategic plan team, this is individuals throughout the organization from various departments coming together to work together on developing and implementing and achieving our strategic plan. Our strategic initiative number 1, enhance public protection through collaborative leadership. I will highlight a couple of the objectives in this, and that's ensure fair, efficient, and effective regulatory processes. We have 2 targets that I will highlight. The first one is review and revise all regulatory policies to ensure alignment with our laws and rules. Dr. Catherine Moore, Rob Patchett, and Angela Ellis are working on this process, and they've created a policy review crosswalk. They're reviewing a process timeline to include work to document our North Carolina Board of Nursing statutes, laws, rules, and policies within the National State Auditors Association's best practices for carrying out a state regulatory program. The second target, review recidivism data for practice cases to identify any trends. Angie Mathis is working on this with her team, and she has collected 2 years of data with top allegations for RNs and LPNs. And then the next step will be to review those select allegations to determine how we're going to look at this further. The second objective on this slide is to promote legislative change that advances public protection through exemplary nursing care. Dr. Tillman highlighted some of that, and I will not steal Dr. Moore's thunder on the legislative update that she will be providing shortly, but wanted to highlight that Dr. Tillman and Dr. Moore provided a presentation to the North Carolina Institute of Medicine Task Force on the future of nursing workforce regarding regulation of nursing workforce in North Carolina. The next objective is increase visibility and impact of our organization. The first target is the website redesign and platform upgrade. We have a website redesign team or review team, and that is composed of Brad Gibson, Travis Fish, Angela Ellis, and myself. We've been meeting with our website designer and developers and have made some adjustments with our website along with some of our colors of our logo to ensure that we're meeting ADA standards. They are big sticklers for the ADA standards on the website. We'll have more details at the September board meeting regarding the timeline for this project. The second target is to utilize current technology to provide stakeholders a better understanding of how to access our information. We are very active on social media. We have a robust website, and we highlight that information for the public and nurses of North Carolina. We also offer the Nurse Leader Regulatory Orientation, and that's conducted by our practice staff, Joyce Winstead and Stacy Thompson, and then our Education Summit offerings held by our education staff, including Dr. Lewis, Ward, Milner, and Tanya Bodie. And then the last item that we publish is our bulletin, and that comes out 3 times a year. And I will also highlight that is 100% electronic now. When we did the Metrolina event, individuals were still asking us for paper copies. The next item is to increase visibility and impact of our organization. Our target is to disseminate information on our social media platforms, increase outreach to external organizations. We have a communications team both for our social media and our bulletin. For our social media team, we have Catherine Soderberg, Brad Gibson, Angela Ellis, Paulette Hampton, Jess Castro, LaTarsha Flowers, and myself. Cannot do this work without them. And then the bulletin team, we have Brad Gibson, Angela Ellis, Paulette Hampton, Catherine Soderberg, and myself. For our LinkedIn followers, we have seen an increase since I provided the update in your packet to 731 individuals following us on LinkedIn. And we had 29 new followers in the last 29 days. So I thought that was very interesting. We're almost at about 13,000 individuals who have liked our Facebook account. Our Instagram is slowly growing at 142 followers. We also live stream our meetings, such as this one. Our education rules public hearing, we had 63 individuals on that live stream. Our January board meeting had 23 individuals. And then our September 22 board meeting, we had 70 individuals watching our board meeting. The second strategic initiative is advanced best practices in nursing regulation. And the first objective, conduct, utilize, and disseminate research that expands evidence for regulation. Again, Dr. Tillman indicated earlier that she has signed the contract to start working with the Shep Center on our APRN workforce study. And then the second objective is to serve as a catalyst for delivery of innovations in education and practice. And the target is to establish and offer standardized presentations for newly licensed nurses and do that either virtually and or in person. And a new presentation was created, with the first offering at Cape Fear Health System by Joyce Winstead and Stacy Thompson with support of Paulette Hampton. Our third strategic initiative is to cultivate an organization that supports diversity, equity, and inclusion. The objective is to promote a diverse organizational environment that fosters creativity, innovation, and outstanding leadership. Our target here is to encourage professional development, leadership preparedness, and succession planning. One of the great things about being a member board with NCSBN is that we're able to enroll in their courses that they offer. And so we have multiple staff members as well as some board members working through the ICRS courses that are offered through NCSBN. Our fourth strategic initiative, foster mobility of licensed nurses and facilitate access to nursing care. The objective here is to facilitate safe and effective practice of nurses using telehealth and emerging technologies. The target is to monitor practice consult calls for trends and issues related to telehealth. The practice department is continuing to monitor these calls to inform the discussions that are occurring with the Education and Practice Committee. Our next Education and Practice Committee meeting is on August the 3rd. Any questions? Yes.
I know it's on the website. I know we can get to it on SharePoint, but could you have someone email that to the board?
PowerPoint?
Yeah.
Absolutely.
The PowerPoint or just the strategic plan as a whole.
Yep.
It would be easier just to grab it via email and look at it and keep it in the email if it's possible.
Sure,
That's
we can do
okay.
that.
Thank you.
Mhm.
It's great work.
Yes. Thank you all.
Thank you, Dr. Griffith. We will now ask Dr. Catherine Moore to present our legislative update item, agenda item M9.
I'll also just need a minute to get set up. You're also not on the right page. Let me reset that. My apologies, Madam Chair and board members. We did practice this morning. I'm ready, Madam Chair. So thank you, Madam Chair, Dr. Tillman, and board members for the opportunity to present a legislative update to you this morning. As Dr. Griffith mentioned, this, for her presentation, mine is also going to be abbreviated. I think that that's probably a relief to you, given the long list that you saw in M9. What you see in your board packet is a legislative tracking dashboard. So the board did approve in last year's budget for software that that we're able to use to track legislation and present that tracking to you in a more structured manner. And it also helps me with keeping notes and like just monitoring the bills that we're looking at. And so you had that before you. I'm really going to focus more on some of the latest activities at the General Assembly. And I will say as a caveat, even though it's wonderful to be able to present to you today an update, things might change this afternoon, they might change tomorrow or next week, and conversations truly are ongoing. So before I start speaking about North Carolina specific legislation, I did want to point out a federal law that was signed January 5th of 2023. It's the Veterans Auto Education and Improvement Act of 2022. Section 19 of that law actually had provisions in it related to the portability of professional licenses of military servicemen and their spouses. So what that law has done is for individuals who are military and their spouses who have to move from one jurisdiction to another because of military service, their license, like their nursing license, is covered and considered valid in the new jurisdiction where they're practicing at a similar scope of practice. And so what they have to do is present a copy of their military orders to the new licensing authority. They need to remain in good standing with their previous licensing authorities. And then they need to submit to the authority of the new jurisdiction. So as far as their standards of practice, disciplinary authority, and continuing education requirements. The law also had provisions in it related to interstate compacts. So if an individual is able to practice in multiple states on that compact, they need to be subject to those compact requirements and any accurate laws. And so that's a piece of federal legislation. Staff have looked at it. We're keeping in touch with the National Council of State Boards of Nursing on the way that this is being implemented at a federal level. Also, Secretary Gaskin of the North Carolina Department of Military and Veterans Affairs has been in communication with the licensing board. So we're all up to date on how this is being rolled out and how we need to change our processes. So some exciting session summary points for the 2023 legislative session. We currently have about 1,600 bills that were filed this session, 895 in the House and 745 in the Senate. We usually see about 2,000 at the conclusion of sessions. The crossover date was May 4th of 2023. And I know in previous presentations, when I've given you that lovely graphic of the bill process, I saved you from that today, but where we are in that is a bill needs to be filed in one chamber, the House or the Senate, make its way through the committee meetings, be voted on in the chamber of that, and then cross over to the other chamber to continue on the process. So that date was May 4th for that to happen. Now, the legislature has a lot of other tools in their toolbox. So if something didn't meet crossover, there's a way of getting that language into bills. And so that's not a drop dead for things. And I have some examples of that today. We have 14 bills that have been chaptered this session, with 2 overridden by the governor, and both of those overrides were, vetoed by the governor. Both of those were overridden by the General Assembly. Dr. Tillman did talk about how workforce is a huge discussion across the country, the state. And recall back in our previous session, Dr. Frere actually was able to present NC NurseCast to members of the General Assembly. They had a health workforce subcommittee, and she gave a presentation of the findings of NC NurseCast. And in her presentation, she said, "I have never been so worried about a workforce." And so the legislature heard that last session, and at the end of the session in the budget bill, session law 2022-74 had a requirement for the North Carolina system and the community college system to study and provide recommendations in a timeline for increasing nursing graduates and constituent organizations by 50%. So that was submitted in, I think the due date was February. They may have submitted it a little bit earlier. But it, gives recommendations. It's available on the General Assembly website. If you don't have a copy of it now, I can definitely get that to you. And it provides recommendations. And in that, they do talk about the resources that are need to be allocated to schools of nursing, to faculty to support the recommendations, but that it is a goal that can be accomplished. And Dr. Tillman did note that, this is the education piece, and graduating more nurses is not going to fix the issue. There are the retention workforce considerations too, but this is one step that the General Assembly directed at the conclusion of the session last session. So getting into some of our bills for this session, one of the bills passed was the Medicaid expansion bill. So that passed March 3rd of 2023, and it is linked to, our budget needs to get passed too for this to be implemented. And it would provide Medicaid coverage through NC HealthWorks to adults age 18 through 64 with incomes up to 133% of the federal poverty level. The previous session, when the Medicaid expansion bill was discussed, it also had provisions for full practice authority for advanced practice nurses. That was not included in this law that passed, but the leaders in the General Assembly are still discussing those types of provisions, and I'll give a little bit more clarity to that in a few minutes. So, as Dr. Tillman mentioned, Senate Bill 20, Care for Women, Children, and Families Act, it did pass. May 16th, 2023 was when the override bill vote took place, and so that has actually become law now. My comments are going to focus on those midwifery provisions that were in that act. And so the midwifery provisions include a path towards full practice authority for certified nurse midwives. And the language that was actually inserted in that bill, it came from proposed language from 2015 from a joint subcommittee report on midwifery and a study that was conducted at the General Assembly. So instead of the current requirement for physician supervision of certified nurse midwives, they would be required to have a collaborative practice agreement with either a physician who practices obstetrics or a certified nurse midwife and that's for those individuals who have less than 24 months or 4,000 practice hours. So they are required to have that collaborative provider agreement. And their collaborative provider that they enter into a contract with needs to have at least 4 years or 8,000 hours of experience. The Midwifery Joint Committee is tasked with creating rules governing the prescriptive authority of certified nurse midwives, and those are to be consistent with the rules for nurse practitioner prescriptive authority. And then they also note requirements for certified nurse midwives to use an informed consent agreement related to the discussion and associated risks of an out-of-hospital delivery, so birth center deliveries, at-home deliveries. And they do have limits on the planned births attended by certified nurse midwives in this legislation. And then upon completing that 24 months or 4,000 hours of practice, they can submit documentation to the Midwifery Joint Committee, and then they're authorized to practice midwifery independently. So that has become law, and board staff have been involved in discussion with the chair of the Midwifery Joint Committee. So, and there are also ongoing discussions. There were some technical issues noted in that section of the language. And so there are going to be a couple more discussions during this session related to that provision. So moving on smoothly to the SAVE Act. The SAVE Act bills, Senate Bill 218, House Bill 218 and Senate Bill 175 were filed this session. Neither of those bills have independently received a hearing. They have been discussed a lot. This screen capture here is just the updated list of organizations, in addition to nursing organizations that have voiced their support for the SAVE Act. And as I said, conversations are ongoing. One of those conversations was in February. The Board of Nursing was asked to provide testimony during the Senate Healthcare Committee meeting that occurred, and we were specifically asked to provide information on the impact of the COVID-19 legislative waivers for nurse practitioners that were in place. And recall those, they remove the requirement during COVID for nurse practitioners to have those quality improvement meetings and the associated documentation. So, the pandemic and those waivers were in place for almost 3 years. The data that was presented during that meeting went from 2018 and 2022. Angie Mathis was extremely helpful in providing data related to the the disciplinary cases seen from nurse practitioners. And we were able to show that even when those waivers were in place, we did not see an increase in the trend of disciplinary actions related to nurse practitioners. Additionally, when those waivers were put in place, nurse practitioner approval to practice their renewal applications on the website, they were updated with some voluntary questions just to gather some information from nurse practitioners on their perceived impact of those waivers. Were they, actually were they actually implemented in their healthcare systems and organizations where they were working? And what we found is that nurse practitioners perceived that implementation of those waivers either had a positive impact or did not impact the efficiency or quality of care that was provided. And so we were able to share this information, share this data during that Senate Healthcare Committee meeting, and it's been part of some of the conversations that have been taking place. And these are just some pictures from that meeting. We were able to get a picture with Senator Adcock and Senator Bergen afterwards, and you can see that Angie Mathis and Doctors Mabry and Louisana were actually there with me to provide support and help answer any questions that may have come up. So one of the bills, we've had a lot of bills related to nurses in schools that have been filed this session. We've had them filed in previous sessions. One that made it through crossover was House Bill 382, and it's entitled Registered Nurses in Schools. And it states that registered nurses who have at least 2 years of practice as a nurse in a hospital or clinical setting can be employed as a school nurse, and they should not be required to possess or obtain any additional certification. This is not, there is also language in the Appropriations Act in the House and the Senate side related to school nursing. It's not this language, though. That language actually states that a nurse, that the Board of Education will create the criteria that are required for the school nurses, and they are not allowed to require that school nurses have a 4-year degree. There are ongoing discussions related to that. Yesterday, during the budget discussion, Senator Adcock submitted an amendment. She withdrew the amendment, and there was the plan is for that to be further discussed during their conference discussion of the budget. So that's going to be an ongoing discussion. Senate Bill 310, solving the preceptor crisis. This language actually didn't have a hearing, but it was included in the House version of the budget. And it tasks the North Carolina AHEC to study and submit a report to the General Assembly on the impediments to the availability of community-based preceptors for healthcare professional students, including nurses. And the Board of Nursing is actually mentioned as one of the organizations that is to collaborate with the North Carolina AHEC in this work. So again, we'll see if this is something that ends up in the final version of the budget. Senate Bill 380 states that physicians are prohibited from charging for or receiving payment for activities related to nurse practitioner collaborative practice agreement or certified nurse midwife supervisory agreements. It actually would create a Class 2 misdemeanor if they were found in violation, and establishes a fine of up to $1,000 for the first violation and $5,000 for subsequent violations. And also that physicians that were found in violation could be it's considered unprofessional conduct that would be subject to discipline by the North Carolina Medical Board. Senate Bill 385, it creates criteria that would require anesthesiologists to comply with during their supervision of anesthesia care provided by CRNAs. And it also has, it would require that insurers only reimburse anesthesiologists at 50% of the rate for that for supervising a case versus if they had been providing the anesthesia services during the case by themselves. Now, neither of those bills related to the payment for the collaborative practice agreement or those anesthesiologists, those have not received a hearing, but they did end up in the Senate version of the budget. So that's why I pointed them out. I think they're going to be part of ongoing discussions related to that. None of the SAVE Act language is in the current version of the budget. And so I don't have any crystal ball here, but I think that there's going to be some ongoing discussion related to those items. So where we are with the Appropriations Act status, the House version of the budget had its third reading April 6th of 2023. The Senate had its second reading yesterday, and I haven't looked. They're supposed to be meeting right now to have the third reading of the bill in the Senate. And so after that happens, it would then need to go to the House for a concurrence vote. When they vote not to concur, that's when that conference committee is assigned. And then you have legislators from the House and the Senate that get together, look at the two versions, and then come to a compromise on what that final version will be. And then that's presented to both chambers for a vote. So we've still got some negotiation to wait through, and there will be a lot of change the next time I get to speak with you. So also in the Senate version of the appropriations bill, there is funding for increasing salaries for nursing faculty in the community colleges and the UNC system. So it would increase starting pay for nursing faculty by an additional 10% above the broad pay increases that they have for faculty. And then for nursing faculty, current nursing faculty, they can receive up to an additional 15% salary increase. There's also provisions for school nurses in the Appropriations Act. And what they've done is they've moved positions and funding from one allotment, I think it's the instructional support allotment, over to the school health personnel allotment to transfer funds for that 3,241 school nurses, school counselors, and social workers. And then it also provides funding for an additional 120 positions. So I jumped ahead of myself earlier when I talked about provisions that are in the Appropriations Act, the Senate version. So now I can answer any questions, maybe.
I have a question.
Yes.
What is the difference between NCH, well, so House Bill 336 and then House Bill 382 around the school nurses?
336, I'd have to look at that one. I think I know the answer to that.
So, yeah.
Healthy nurses in every school. So that's to require a specific number of nurses for each school versus the criteria to be classified as a school nurse.
Oh, okay, all right, understood, thank you.
Bear with me, Dr. Moore. I have a few questions.
Okay.
So Title VIII funding, have you heard anything about that, or is there going to be, I'm concerned that that's on the table in terms of reducing it, where it's been something that we absolutely need to continue with the funding for education and,
I have not been part of discussions related to that, and that's something I'll need to follow up with.
okay. I think just for education, for the board and others, the SAVE Act from the federal side is different than the SAVE Act for North Carolina, unless I'm wrong, but the SAVE Act at the federal level is about workplace violence and, or am I confusing that? Because obviously I know what
No.
the SAVE Act is for North Carolina.
You're correct. Yeah, you're correct.
Okay, so have we gotten anything in it? Have you gotten any additional information about the SAVE Act on the federal level?
No, and that's something that, I would have to dig in to give you a more accurate status update. I'm much more involved in monitoring
Sure.
the state specific, but I
Yeah.
haven't had any recent information that's come into my inbox.
I just think it's important that we keep our eyes on that, or at least awareness of it, because I'm still continuing to see, I'm sure many of you are as well, the workplace violence is a very, very real problem. At 4:30 this morning, I got a phone call about an incident. So it's real. It's still continuing to happen in our society. Unfortunately, it's just creeping over into the medical and the clinical side, and especially nursing. So just
And-
something I would appreciate it if you could.
And
And-
can I follow up on that?
Yeah,
And I don't
sure.
have the bill number in front of me, but there is a bill for North Carolina related to workplace
Oh,
violence.
Okay.
It's in there it is. It's House Bill 809, the Hospital Violence Protection Act. That bill did meet crossover.
Oh, it did.
Mhm.
Okay, good. And then maybe the toughest question is, what is it going to take from your perspective to get the SAVE Act, North Carolina SAVE Act through? I mean, I remember back in 18, I think we kind of, correct me if I'm wrong, Dr. Tillman, but I think we kind of parted ways with the NCNA when we were trying to kind of push that bill, their agenda and the SAVE Act together. We took that apart, and we're still not any closer.
So, I can answer that question. We didn't part ways. What happened, we had a very long bill from previous sessions, and it had the full practice authority legislation for the APRNs, and it also had technical corrections for the Board of Nursing related to our investigations and things like that. And, those had been combined in one bill for several sessions, and it was a long bill, and it created confusion because there were kind of separate issues. And so there was a mutual agreement between NCNA and the Board of Nursing that it would be more efficient and it would reduce the difficulty in explaining that bill legislation if we separated the two bills. And so that was the reason for that. For the SAVE Act specifically, as I said, conversations are ongoing with that. And I think that one thing we can all do, if that is something that you are interested in, is contact your legislator as a nurse, as an individual, not the Board of Nursing.
Right.
But if that is something that you want to share your expertise with your legislator, that you can certainly, have that discussion with them as their constituent. And, they've already seen that there's plenty of support from individuals other than nursing organizations, but really it's the legislators need to have that conversation and figure out what it is that they think is in the best interest for access to care and for their constituents as far as the care that is provided. And so it's just going to take ongoing discussions, and I think that those discussions are ongoing, and I think we'll just have to wait it out this session. I mean, and the certified nurse midwives, those provisions, they are a step. But I do recognize it's just one of the 4 provider roles.
Yeah, and to your point, I've gone through AONL. I've been up to Washington. I've done some lobbying and some just letting them know as a nurse my opinions on it, and they are very receptive. They do listen. They do pay attention. It's just a long haul to try to get this bill to go through. So.
Yeah, and it's not dissimilar to the path of other states too.
And Dr. Moore, you may want to talk about NCSBN, how they're collaborating with NCNA for the long session
Yep.
to help.
So NCNA has lobbyists, for their organization, for the SAVAC, and the National Council of State Boards of Nursing is one of the authors of the APRN consensus model, has a vested interest in getting that consensus model implemented throughout the country. And, bills like the SAVAC, they provide resources to states and collaborate with the advocacy organizations in that. And so they have been involved this session and identified North Carolina and the SAVE Act as one of the bills that they wanted to. And so they, in addition to NCNA's lobbyists, NCSBN has a lobbyist that is, talking from their perspective. And so there have been additional outside resources that have been devoted to that. Thank you, Dr. Tillman.
And I think to Dr. Moore's point, there are other opportunities at Nurses Night at the legislature that we can talk to the legislators as well, and that's a good opportunity. But again, representing ourselves as nurses, not as a Board of Nursing member. Dr. Moore, thank you for this information. This is much needed and very welcome. I do have a question in regard to Senate Bill, I think 380 and 385. Did I hear you correctly when you stated that they received a hearing in the Senate, but they did not receive a hearing in the Senate, but they have a current version in the budget. Is that correct? Did I hear you correctly?
Yes, so
Okay.
that's one of those when I talked about tools in the legislator's toolbox.
Mhm.
A bill does, the normal path is it gets filed, it goes through individual committee hearings, it's debated along the path, it gets the votes. In the examples of those two bills, they were filed in the Senate, but they didn't on their own go to a committee for a hearing and debate. Instead, that language from those bills, legislators decided to include it in the policy portion of the Senate's version of the budget. So that language is in that document now. And that was the whole document all combined. I think the report plus the bill is almost 1,000 pages. And so there's a lot in there. And that language was included in that entire bill was discussed in the Appropriations Committee, the Pensions Committee, and then it had its second reading on the Senate chamber yesterday and passed. And at 10 a.m. today is when it was going to have its third reading in the Senate chamber.
Thank you, Dr. Moore.
Dr. Moore, we thank you for always providing us with such an informative legislative update. At this time, board members, we will take a break. We will come back about 20 minutes till, and at that time, we will reconvene. Thank you. Okay, we will now call the session back into order, or I guess I will. We've now reconvened. I will now recognize the Finance Committee. Members of the Finance Committee include Mr. Tom Minowitz. Committee members are Ms. Edna Ennis, Dr. LaDonna Thomas, Dr. Shakira Henderson, and our staff liaison is Ms. Gail Bellamy. Dr. LaDonna Thomas will be presenting on behalf of the committee chair, Mr. Tom Minowitz. Dr. Thomas.
Good morning. Thank you, Madam Chair. Good morning, everybody. I will be presenting the financial report in the absence of Mr. Tom Minowitz. So M10, summary of activities. The committee reviewed the following financial statements at its April 26, 2023 meeting. Statement of net position, statement of revenue, expenditures, and changes in net position, fiscal planning, budget. The statement of net position. The statement of net position summarizes the financial position as of March 31st, 2023. Assets totaled over $27.8 million. Liabilities totaled over $10 million. Net positions totaled approximately $17.8 million. Statement of revenue, expenditures, and changes in net position details how the financial position changed during the third quarter of the fiscal year. Revenue, operating revenue totaled $8.6 million, an increase of $310,425 or 3.7% when compared to the same period last year. Net non-operating revenue totals $554,799 and reflects positive change in value of the investment portfolio. Net revenue was $9.2 million. Expenditures totaled $8.0 million, an increase of $457,857 or 6% when compared to the same period last year. The result net position is $17,793,987, a change of $1,165,943 from 6/30/2022. At this particular juncture, I would like to introduce Wes Thomas and Jessica Christie, Wells Fargo advisors, to present market analysis and investment performance report.
Good morning. It's good to be with you. I actually threw you a little bit of a curveball. I've got Amy, Amy Earl with me today, not Jessica Christie, but with the three of us work as a team. There's myself, Jessica Christie, and Amy Earl. Jessica stayed at the office to hold down the fort, so they say, but we're all part of the team. I'm gonna turn it over to Amy to go over the performance and briefly, and then I'll go through a little bit of a market overview because there's a lot going on in the markets right now. So Amy, I'll let you do the performance.
Good morning, y'all. I'm glad to be here with you as well. We were just saying how much we've learned from being able to listen to your session about what y'all do. And I am always humbled and grateful to come here and to be a part of this. So thank y'all for everything you do. Briefly, the performance, we are headed in the right direction. What I'm going to go over with you is the information that came from our finance committee meeting that we had in April. This is data as of the end of March, so we're just using that same data just for the sake of continuity. Wes will be talking about kind of what's going on in the markets currently, but this performance information for your accounts is as of March 31st. Right now, your stock account makes up about 32% of your whole portfolio, so overall you're conservatively invested. Your bond account makes up about 68% of the overall portfolio. When we think about how the accounts did as of the end of March, the stock account was up 3.49%, so about 3.5%. The bond account was up 1.81, so just under 2%. The total portfolio through the end of March was up 2.35%. Doesn't sound like a big number, and yet we're headed in the right direction, so it's a good thing. For comparison, Through that period, through the end of March, the S&P 500, which is an index y'all have probably heard about in the news, that was up 7.5. The Dow Jones was up just under 1% at 0.9. What we look at for your accounts, though, is what we call a blended index. So we want to make sure that the index matches what you're actually invested in. Your blended index was up 2.85%, whereas your account was up 3.49. So your account did a little better than the representation of what you're invested in the markets showed us for that time period. The US aggregate bond index for your bond portion, that was up 3%, whereas your bond account is up about 1.81. So not much different, but just a little bit less. One of the things that we like to point out is when things like that happen is, well, kind of why might that happen? A thing to keep in mind is about half of your bond account is made up of CDs. And as you may or may not know, there's an inverse relationship between the value of fixed income stuff and when interest rates are moving. So when interest rates are going up, the value of those things are going down. The same goes for your CDs. The interesting thing about CDs, though, and other fixed income investments is they mature at what we call par. In other words, you're going to get your whole investment back plus interest. That's not reflected in the current things as they fluctuate up and down, though. So just so you know, some of those things may be showing to be down a little bit right now, but when they mature, you're going to get back the full value plus the interest that you had. So just something to note. That's it for the performance section. Do y'all have any questions before I turn it over to Wes to talk more about current markets? Okay, thank you.
Okay, well, we have experienced a little bit of a bounce in the markets, which is very positive. You know, this bear market has lasted since January of last year, so we're glad to have some positive news for a change over the last several meetings that we've been involved in, and we're moving in the right direction. We haven't seen the breadth in the market yet, so just as Amy said, the S&P is up like 8% year to date, and that's been heavily influenced by some of these large mega cap tech stocks that have done well this year, but that did poorly last year. So we haven't seen the breadth that you would like to see in a total market recovery, but we're moving in the right direction, and the markets have accurately predicted that the Fed is close to the end of raising rates. And so that's what the market move is really all about, is the Fed. Wells Fargo believes that there's a possibility of one more interest rate increase in June, but most of Wall Street, the consensus opinion is that the Fed is done raising rates. And that is a positive thing for stocks. And so we do have a very positive backdrop, despite having some near-term challenges. And when I say that, you know, we've recently gone through the bank failures where we've seen Silicon Valley Bank fail, Signature Bank, First Republic, and all of those failures in the banking system act almost like credit tightening from the Federal Reserve, because when banks fail, the rest of the banks tend to tighten up and take less risk and tighten their lending standards. And credit is like oxygen to the economy. So at Wells Fargo, even though we think there's a good backdrop long term that the Fed's done raising rates, we still are predicting a recession this year. And you know, a lot of people are debating that, whether we're going to have one. It seems like it's the recession that's everybody talks about that never comes. We think it's coming. That's our base case scenario. So we're very cognizant of that. We're positioned for that in the portfolio very conservatively with super high quality bond investments and stock investments. So we are positioned appropriately. Of course, we also have the debt ceiling, and it looks like there may be some positive developments in the last day or so, but you know, still a deal has to be reached, and the deadline's approaching. Some suggest that deadline is the 1st of June. Others, you know, they might be able to prioritize expenses and go on a little longer, but that is a headwind, and if that uncertainty will create some drag on the economy if a deal is not reached. We saw in 2011 a similar instance happen where the markets fell 12%, and it took some time to recover from that, but we did recover. So I would not be surprised at near-term volatility, but longer term, we do have a favorable backdrop of the Fed, at the end of its tightening cycle. The good news that I'm going to leave you with is that markets tend to always be forward-looking. And so markets today are reacting to news or what they think will develop 9 to 12 months down the road. And when we look out 9 to 12 months, we are anticipating that the economy will be recovering. It'll be coming out of this recession. And so markets are responding to that. That's why I think they're bouncing now. We may have near-term volatility, but the longer-term backdrop is very positive. Markets tend to bottom ahead of the recession bottoming. And if you'll remember, all a recession is 2 negative quarters of GDP. So we think that we just got to get past the debt ceiling. And then there's probably we'll see some positive developments in the market, even though we will be in the middle of a recession, sometime the middle of this year to late this year. So I'm going to pause there. The real thing that we're doing at Wells Fargo Advisors with the Board of Nursing is working with Gail and the Finance Committee to make sure that we stay just very properly positioned for that recession. But as we come out of it, we're going to be looking for opportunities. And I hear of all the action that the board is taking. You're clearly a board of action from what I heard this morning. And we are taking action and locking in high yields. We've got CDs and bonds at 4% and 5% now, and we're locking those in, and which is exciting to us. This may sound boring to you, but locking those in, and then as we get into the recovery phase of the recession, we will be making changes to try to take advantage of the upside that we might see in the markets. So thanks for having us, and I'll pause for any questions.
So if I'm hearing you right, from a board perspective, if we lock in on a few CDs now, right, 1 year maturity or 18 months maturity, it's perfect if the recession turns at that point, because then you're out of the window for the locked CD, and then you can reinvest that money into more aggressive because the market has turned. Is that fair to say?
Yeah,
That's the strategy, I guess.
That's fair. We're trying to just take advantage of whatever the yield curve gives us. And so right now, shorter term CDs are around 5%, but we also are trying to lock some in for a little longer because we actually think that this could be a peak in interest rates. Like the Fed is done raising rates, and while we don't think they can turn around and cut rates quickly if we go into a recession, we think they would pause. But the markets are forecasting, and we are too, that perhaps sometime next year that the Federal Reserve would actually be cutting rates. So we're trying to lock in some things for longer, realizing that next year rates may be significantly lower. And we may look smart locking in yields at 4.5% to 5%. Okay. Well, yeah, thanks for having us.
Thank you for the update. Thank you.
Thank you so much. We always appreciate your updates, and especially for helping us to balance, maintain, and especially the progression. We appreciate. Thank you.
Thank you, Madam Chair.
At this time, if you look in your packet, M11, the fiscal planning budget, That will be presented by Ms. Gail Bellamy.
I think it's on, yes. Thank you, Dr. Thomas. The Finance Committee met in April and reviewed the proposed budget in great detail. We almost took line by line and went through, had discussions, and also in your packet there, highlights of the discussion, some of the changes that are being proposed as it relates to the current year budget that that we're operating under. I think the big takeaway, the big point that wanted to make about the budget is that in spite of I heard a lot of talk about the workplace issues. Our revenue still remains very reliably solid, which tells me nurses aren't leaving the profession. They're still renewing their license. So our main sources of revenue are, we haven't seen any impact there. And if you look at the long range forecast along with the budget, it's a 5-year projection, and again, kind of making certain assumptions over the next 5 years. And the main one being the first one there, that our current business model remains the same, that we remain independent. Of course, as we've heard from Dr. Moore, legislation is always a factor that could impact our financial status, but we're feel like that we'll maintain the stability within our finances that we have over the past few years. So we do have a reliable revenue source that we don't see anything that we can see on the horizon that would negatively impact that. So the committee is recommending a balanced budget of a little bit over about $11.7 million, about a 4.5% increase. And that's consistent with the budget increases that we've seen over the years. So I will ask if there are any specific questions that I can answer about the proposed budget. Mhm.
Thank you so much. Just a quick question about research. What is the overall goal around increasing the research budget? And then the other budget item was the reduction in miscellaneous. Were those like miscellaneous budget items that you don't anticipate?
Right. The research, as you know, there are two components to the research budget. We have the operating, and then when we get to the designated funds, there's also funds available for research there. So we have as Dr. Moore mentioned, the project with the SHEP Center, also looking at, and Dr. Griffith will forgive me if I get this acronym incorrect. Within the monitoring program, there is a research project concerning MATs, medication-assisted treatments, which I think has to do with the drug that you can, when someone is in overdosing, to be able to administer that drug. Is that correct?
So many of you may have heard it by the name of Suboxone. Yeah.
Yes. Sorry, when I start talking, ask me a finance question and I got you. When you get me into the medical, you see I'm stumbling. So that's when I call on my colleagues. But yes, it is a research project related to from the monitoring team to look at drug as it relates to opioid crisis and so forth. Yeah. Did you? Someone else? I solved the question. Oh, your second question, miscellaneous. Included in miscellaneous was, it's related to investigations for APRN And we have used experts when a case comes up, expert reviewers of APRN cases. But now we have APRNs on staff, we have our investigative team. So we're using fewer of the APRN external experts to review APRN cases. So that budget is being reduced because more of that activity is being done in-house. Yep. Other questions?
Okay, seeing none. So the committee's recommendation is that the board approve the proposed budget for fiscal year July 1st, 2023 through June 30th, 2024. Is there any further discussion? Seeing none. This is a committee recommendation, so we do not need a second. I will now call for the vote. All in favor by show of hands. The vote is unanimous and it carries. Thank you. And so now, Ms. Bellamy will present on our designation of funds, agenda item M12. Dr. Thomas, forgive me.
That's okay. Thank you, Madam Chair, and thank you, Ms. Bellamy, for that report. So M12, designation of funds. The following designation of funds is requested. Legal defense risk management, $700,000. This designation maintains a funding source for risks retained by the board. Example, not transferred to an insurance company or other third party. Research, $300,000. Designation of additional funds to support phase 2 of the APRN workforce study by the Shep Center, in addition to currently identified research projects. North Carolina Board of Nursing maintains a funding source for other studies that advance nursing regulation. Educational assistance, succession planning, and strategic planning, $110,996. This designation will ensure fund availability to provide assistance in accordance with the organization's personal policy. Also to have a ready source of funding for recruitment, relocation, and retention of appropriate staff. The recommendation, the committee recommends that the board designate $1,110,996 of unrestricted net assets for future funding needed described. Madam Chair.
Thank you, Dr. Thomas. So the recommendation coming from the Finance Committee is that the board designates $1,110,996 of unrestricted net assets for future funding needs as indicated. Is there any further discussion? Seeing none, this is a committee recommendation, so we do not need a second. I will now call for the vote. All in favor by show of hands. Unanimous vote, the motion carries. Thank you, Finance Committee.
Thank you.
I will now recognize the education program activity, the staff, Dr. Terry Ward and Dr. Anne Marie Milner.
Madam Chair, members of the board, thank you. I will be presenting a summary of a report for Asheville Buncombe Technical Community College in Asheville, North Carolina. The North Carolina Board of Nursing received an application from Christy Andrews, MSN-RN Nursing Chair with Asheville Buncombe Technical Community College, AB Tech, to establish a PM program. The proposed PM program requires 14 non-nursing credits and 30 nursing credits to be completed across 3 semesters. The maximum total enrollment approved by the North Carolina Board of Nursing is 30 students. The proposed date for admission of the first class to the nursing program is August 2023. The proposed program will be physically located at AB Tech Community College in Asheville, North Carolina. The application demonstrates evidence of the proposed student population, projected student enrollment, financial resources, and learning resources to implement and maintain the program. The current physical facilities are adequate to support the program's needs for both students and faculty. Clinical agencies provide proof of availability for utilization by the proposed program. An initial survey was conducted on January 23rd, 2023. There were no recommendations as a result of the survey. The recommended board action is that AB Tech Community College be granted initial approval for the establishment of a PN program with a maximum total enrollment of 30 students to begin fall 2023. The representatives of the community college are on virtually attending this meeting.
Thank you, Dr. Ward. So the motion has came forth. It's a staff's recommendation. The motion is that Asheville Buncombe Technical Community College be granted initial approval for the establishment of a PN program with a maximum total enrollment of 30 students to begin fall of 2023. So I need that motion from one of you, please, board members. Okay, the motion has been made by Dr. Laura Bartlett. Is there a second? Seconded by Karen York, Ms. Karen York. Any further discussion? Seeing none, I will now call for the vote. All in favor by show of hands. The motion carries. Congratulations.
Madam Chair and Board, thank you for having us. I want to introduce Dr. David Hudson and Dr. Sandra Affinito. I thought I was gonna, she's the Vice Chancellor of Academic Administration at Johnson & Wales College, and they're here to support the program. And if you have any questions. Okay, the North Carolina Board of Nursing received an application from Dr. David Hudson. He's the program director with the Johnson & Wales University to establish the Accelerated Bachelor of Science in Nursing program. The application was received January 2023 and included information to support the establishment of the ABSN. The program requires 60 non-nursing credits and 60 nursing credit hours. The maximum enrollment approved by the North Carolina Board of Nursing is 136 students. The proposed date for admissions of the first class is to the nursing program is August 2023. The proposed ABSN program will be physically located at Johnson & Wales University in Charlotte, North Carolina. The first graduating class of the ASBN is scheduled to occur in January 2025. The application demonstrates evidence of the proposed student population, projected student enrollment, financial resources, and learning resources to implement and maintain the program. The current physical facilities are adequate to support the program needs and both for faculty and students. An initial site visit was conducted on February 22nd, 2023, and there was no recommendations that result of that initial visit. And I also went back to see their mannequins that they had delivered, which was not too long ago. So that was nice to see everything put together. So the recommendation to the board is Johnson & Wales University be granted initial approval for ABSN program with a maximum total enrollment of 136 students to begin August 2023.
Thank you, Dr. Milner. So the motion from the staff, or the recommendation from the staff, is that Johnson & Wales University be granted initial approval for the accelerated BSN program with a maximum total enrollment of 136 students to begin fall of 2023. Is there a motion? The motion has been made by Dr. Shakira Henderson. Do I have a second? Dr. LaDonna Thomas has seconded. We'll get to you. Any further discussion? Seeing none, I do have a question. With your start being August, fall 2023, do you already have students enrolled at your institution who are ready to come into the program this fall?
No, ma'am, we are delaying actually the first cohort till January because of an admission cycle. So we just wanted to be prepared.
Okay. Thank you. Any further discussion? Yes.
So similar to that same question, do you have students because of a potential first graduation of January 2025, which makes into what, August 2025? Because of the delay of enrollment, do you also have students who are coming in who have an associate's who want to pursue their BSN? Which is the reason for the 2 years, or?
So to answer your question, there are no students in the pool at the moment because of the rules and regulations. We can't advertise and admit. So, but I'm getting inquiries on a daily basis because word of mouth. So, and it will not be an associate degree to bachelor's. It will be a previously earned bachelor's degree, earning a second bachelor's degree. We have contemplated the thought of the associate degree, but the university and the nursing faculty and myself feel that for this, at this point, the BSN or the bachelor's degree or higher to earn a second bachelor's degree is the most appropriate action.
Okay, so hence the reason for the accelerated BSN
Correct.
program. And then anyone else who comes in would go through the traditional 4 years.
We do not have a traditional plan in place. It is
So this
complete
is strictly being marketed to persons who already have a bachelor's degree
bachelor's
and
degree or
want to
higher.
switch careers or become, or obtain their BSN.
Yes, ma'am. The
Understood.
market is those people who have a bachelor's degree or higher, who want to be a nurse, have always wanted to be a nurse in order to help the workforce.
All right. Do you anticipate a future application before this board to expand your program to include a full 4-year program?
It's been talked about and discussed, but at this point, probably not. But, you know, today
Who
is
knows?
May the 18th, tomorrow is May the 19th. So, you know, I think as we address the workforce and the nursing profession as a whole, which the board is doing a wonderful job at, you know, things change and there may be a need. So I wouldn't say no, but right now the focus is on the fast track, the accelerated track to get experienced individuals with life experience and broad backgrounds into the nursing profession. Absolutely.
Any further discussion? Seeing none, I will now call for the vote. All in favor by show of hands. The vote is unanimous and it carries. Congratulations.
Madam Chair, I present to you an education consultant summary report for South College in Asheville, North Carolina. Joining me are Dr. Danielle Kwasnick, who is the campus president for the Asheville location, and Dr. Katie Thomas, who is the associate dean for the program at this time. The North Carolina Board of Nursing received an application submitted by Dr. Katie Thomas, RN, Associate Dean of Nursing with South College, to establish a PM program. The proposed PM program requires 59 credits to be completed across 4 quarters. The total maximum enrollment approved by the North Carolina Board of Nursing is 120 students. The proposed date for admission of the first class to the nursing program is June 2023. The proposed PM program will be physically located at South College in Asheville, North Carolina, at its existing Asheville campus. The application demonstrates evidence of the proposed student population, projected student enrollment, financial resources, learning resources to implement and maintain the program. The current physical facilities are adequate to support the program needs for both faculty and students. Clinical agencies provided proof of availability for utilization by the proposed program. An initial survey was conducted on March the 27th, 2023. There were no recommendations as a result of the initial survey. The recommended board action is that South College be granted initial approval for the establishment of a PN program with a maximum total enrollment of 120 students to begin June 2023.
Thank you, Dr. Ward. So the staff's recommendation is that South College be granted initial approval for the establishment of a practical nursing program with a maximum total enrollment of 120 students to begin June of 2023. Is there a motion to approve the staff's recommendation? Okay, Dr. Steele has made the motion. Is there a second? Ms. Arlene Imes has seconded the motion. Is there any further discussion? So I do have a question. June of 2023, this is May. So just wondering, do you have a pool of students to pull from to start your program in like just a few weeks?
It is definitely a fast turnaround. We haven't been able to advertise per regulations, but we have received many calls and inquiries, and we do have a pool of those folks that we will immediately reach out to. We are well aware that the first cohort could be small, and we're okay with that. And as we get going, we hope to see that grow.
Dr. Ingram, I'd also like to add in our discussion about this time and which we had conversation and discussion. They currently have, South College is currently operating in Nashville, Tennessee. And they currently have a pool of students in Nashville, Tennessee. And because of the flexibility of virtual learning settings, they can now at this point, we talked about it, that was not the plan. And that was what I was told. That was not the plan, but they do have an existing campus in Nashville, and they are currently meeting their enrollment target really close to it, which is why they're expanding. In addition to that, one of the consortiums in that area ceased and dissolved last year. The Foothills Consortium did, so there's a space now to take up that space.
Okay, so in that case, perfect timing, right? And so another question. So South College is in Asheville. This particular campus is in Asheville. You also have a RN program? Okay, and so with that program, can you or Dr. Ward, are you able to share with, go ahead. I'm sorry.
I'll defer to the program leadership.
Okay, so then program leadership, I'm just interested if you are able to share your current NCLEX scores with the board.
I would be thrilled to share that we ended 2022 with a 100% NCLEX pass rate and have maintained a 100% NCLEX pass rate in 2023.
Yay, congratulations.
With
Yeah,
how many
that's commendable. Okay.
Madam Chair,
Yes.
with how many students tested?
We graduated 25 in 2022.
Yes.
So it begs the question of best practice, right? And how you could potentially help support other schools, especially schools that are maybe struggling. Have you given that any thought? Because that's incredible, and you should be applauded for that. Obviously, you were. So, but how do we move forward with maybe some best practice opportunities and transitioning that information?
That's a great question. As Dr. Ward mentioned, we are South College is a multi-site institution. So we do have 7 campuses across the country, as well as a very active online program. So we, of course, are sharing amongst ourselves, and I'm proud to say that we have great outcomes across all of our campuses. I'm certainly open to any collaborative opportunities, either with the board and its educational components as well, to explore any ways to share best practices. Absolutely.
Yeah, and I can add to that. So Katie and I are both new-ish to Asheville. I came from our Atlanta campus, where we also have a PN program and an RN program, and we are working really hard to get out into the community of Asheville. I know just AB Tech is right down the road from us, and we truly believe in collaboration, and that's going to be an important part of what we do and what I'm going to be bringing to our campus as well as all of our department chairs, is that kind of community engagement and collaboration. Dr. Warden, we all talked about the fact that we shouldn't be looking at each other as competitors in the educational market, that we should all be working together. There's enough of a shortage right now that even all of us combined can't fill. So we need to work together and collaborate in those efforts.
And I've sat here trying to hold it. But I must toot our horn as a department and consultants in the education department, because part of that has been working with this program. We have worked with this program to support them in identifying best practices and identifying outcomes that will sustain them. And it proved to be successful, that we support and work with them, hence their 100%.
Thank you. Any further discussion? Okay, if not, I will now call for the vote. All in favor by show of hands. Okay, the vote is unanimous. It carries. Congratulations.
So, Madam Chair, things change quickly in nursing regulation. Just 2 hours ago, I reported we had 141 nursing programs. Now we can say we have 144 pre-licensure nursing education programs.
So we are growing literally very fast. The next part of our agenda is item M14. Unless board members need a break, we will continue. Okay, so we will continue with the Education and Practice Committee, a summary of our activities. And so that committee is myself as chair. Other committee members include Dr. Laura Bartlett, Ms. Edna Ennis, Ms. Andrea Jepson, Mr. Frank DeMarco, Dr. Amy Steele, Dr. LaDonna Thomas, and Dr. Anna Seaman. And of course, our staff liaison is Ms. Joyce Winstead. And so, Joyce, would you like for me to go ahead and read? Okay. Okay, so as committee chair, our board meeting occurred on March 15, 2023. The Education and Practice Committee received the 2023 charge to review the position statement concerning telehealth, telenursing, and related law and rules, and recommend needed revisions to the board. At the first meeting, of course, again, on March 15, 2023, the board staff provided committee members with a comprehensive review of information about telehealth and telenursing. A resource notebook and summaries of salient points were included, and the information provided included a review of the North Carolina Nursing Law and Rules, the Board of Nursing Position Statement about telehealth and telenursing, a summary of telehealth, telenursing practice inquiries received by the practice department, the results of a telehealth, telenursing survey performed through the National Council of other member states, the National Council Model Act and Rules, and the position paper on telehealth nursing practice, professional telehealth guidelines and standards, other state boards of nursing position statements and guidelines, a literature review of RN, LPN telehealth practice, other state telehealth, telenursing laws and rules for RNs, LPNs, and advanced practice registered nurses, an overview of APRN telehealth regulation and practice, an overview of the Veterans Administration telehealth, and an update on North Carolina legislative activities. The next committee meeting is planned for August 3rd, at which time the committee members will hear from representatives of various practice settings regarding the utilization of telehealth and telenursing. So that is a summary of the committee's activities. Ms. Winstead, would you like to add anything to that?
Thank you, Madam Chair. No, I think that sums it up very well. We're looking forward to hearing from some of the stakeholders and representatives.
Right, well, thank you so much, Ms. Winstead. And again, as committee chair, we do not have a recommendation at this time. Thank you. I would now like to recognize Angela Ellis to present our Chapter 36 rules, the NCAC Chapter 36 rules.
I'm a little short. So. Thank you, Madam Chair. I have three rules before you today. The first two rules are going to be easy. The third rule we'll have more discussion on. So I would direct you to your folders for M15, M16, and M17. We're providing hard copies for you today for these presentations. The first one for M15 is the amendment of 21 NCAC 36.0228 clinical nurse specialist. And it's on page 1 of your attachment. On April 1st of 2023, this rule was published in the Administrative Code. As a reminder, it eliminated the portfolio route for new CNS recognition and aligns with the requirements for certified registered nurse anesthetists, certified nurse midwives, and nurse practitioners. Following publication to the Administrative Code, staff discovered a typographical error in G3C as follows, and you'll see the date highlighted as 2021. That date should have been 2023. While this does not change the intent of the rule, the date does require correction. Meredith Paris, our legal attorney, reached out to OAH and had a discussion with the codifier. The codifier has certain authority under GS 150B-21.5 to correct certain errors in rule after they're published. However, the codifier advised us that this was substantive change in her opinion, and we would have to go back through rulemaking. So we are taking the rule back through the 6-month rulemaking period. Again, this does not change the intent of the rule. It's just to correct the date from 2021 to 2023. So staff is requesting that the board approve proposed technical change to 21 NCAC 36.0228 clinical nurse specialist and direct staff to proceed with rulemaking.
Thank you, Angela. So you have heard the staff recommendation that the board approve the proposed technical changes to 21 NCAC 36.0228 clinical nurse specialist and direct staff to proceed with rulemaking. Is there a motion?
Madam Chair,
Thank you. The motion has been made by Ms. Diane Lading. Do I have a second? Seconded by Dr. Shakira Henderson. Any further discussion? Seeing now none, I will now call for the vote. All in favor by show of hands. Motion carries unanimously.
Thank you, Madam Chair. We'll now go to agenda item M16, which is on page 7 of your hard copy. This is related to 21 NCAC 36.0221 license required. Session Law 2021-3, Section 2.9A permits immunizing pharmacist, as defined by statute, to administer long-acting injectable medications to adults pursuant to prescription. The law came effective on October 1, 2021. The Board of Pharmacy adopted temporary Rule 21 NCAC 46.2514 to implement this section as permitted by statute. After successfully completing the rulemaking process, amended Rule 21 NCAC 46.2507 and permanent Rule 21 NCAC 46.2514 became effective July 1, 2022. The Board of Nursing's Administrative Code 21 NCAC 36.0221E reads, pharmacists may administer drugs in accordance with 21 NCAC 46.2507. Based on adoption of the permanent rule, 21 NCAC 46.2514, the Board of Nursing rule needs to be amended to include the new reference. The proposed amendments were presented to the full board in January 26, 2023. The board approved the amendments. The notice of text was filed with the Office of Administrative Hearings on February 21st, 2023, and published in the NC Register on March 15th, 2023. Stakeholders were notified of the proposed amendments, and a public hearing was held on April 4th, 2023. The comment period for the proposed amendments ended on May 15th, 2023 at 5 p.m., and no comments were received from the public. So staff is recommending that the board approve proposed amendment to 21 NCAC 36.0221 license required and direct staff to proceed with the rulemaking process.
Thank you, Angela. So the staff's recommendation is that the board approve the proposed amendments to 21 NCAC 36.0221, license required, and direct staff to proceed with rulemaking. Is there a motion to approve the staff's recommendation? Okay, Dr. Anna Seaman has made the motion, second by Ms. Arlene Ines. Is there any further discussion? Yes.
And just for clarity, I know it's probably in the minutes or in the documentation. When we say pharmacists may administer drugs, is there any restriction on that, on the drug itself or the drugs that are allowed? Is it just an overview that they can administer whatever that they deem fit?
I would have to do a deeper dive, Frank. but
You
I
see what I'm
believe-
asking, right?
Yes, I believe
Okay.
it is limited only to certain medications. I will do a deeper dive, but I do believe it's limited to certain medications only.
Okay.
Any further discussion? Okay. Seeing none, I will now call for a vote by show of hands. All in favor? Okay, unanimous, the motion carries. Angela?
I'll now direct you to page 9 of your hard copy for the 21 NCAC 36.0300 section approval of nursing programs. I refer back to it takes a village to raise a child, and I will say that the rules are my children, and it does take a village. So I wanted to thank Dr. Tillman, Dr. Griffith, Dr. Lewis, Dr. Ward, Dr. Milner, Dr. Moore, Meredith Paris, and Rob Patchett for all their hard work on this packet of rules. I would be remiss if I didn't recognize Catherine Soderberg and Brad Gibson, who helped me get these rules out to our interested parties through social media and email blasts. I also would like to commend the Education and Practice Committee on their work on these rules. We recognize that a lot of hard work went into them. So in response to the charge that the Education and Practice Committee review and recommend amendments to the NCBON education rules in 21 NCAC 36.0300, approval of nursing programs, the Education and Practice Committee recommended amendments to the education rules and related definitions. The goal of the review was to assure the rules regulate pre-licensure nursing education programs are current, consistent, and conducive to the preparation of nurses able to provide safe, effective care now and in the future. The committee carefully reviewed the literature, NCSBN resources, rules, and practices of other nursing regulatory bodies, and testimony from NC education, regulatory, and practice stakeholders. And I just lost my place. Okay. One moment. The proposed amendments were presented to the full board at the January 26, 2023 board meeting. My laptop wants to act up, sorry. The board approved the amendments to the rules as presented and directed staff to proceed with the rulemaking process. The notice of text was filed with the Office of Administrative Hearings on February 21st, 2023, and published in the NC Register on March 15th, 2023. Stakeholders were notified of the proposed amendments. A public hearing was held on April 4th, 2023. The comment period for the proposed amendments ended on May 15th, 2023 at 5 p.m. Staff received written comments, which are attachment A, starting on page 10 of your hard copy packet, as well as phone calls and inquiries from various education programs across the state. Based on the written and verbal comments received, Dr. Tillman, CEO of the Board of Nursing, issued a statement on April 18th, 2023, which is on page 55 of your packet. Staff incorporated the recommendations identified in Dr. Tillman's statement, which begins on page 56, attachment C. And I know that's a lot of information. Upon further review of the proposed amendments and comments received, Dr. Tillman met with appropriate staff to discuss next steps. Staff reviewed all comments, considered the current legislative environment, as well as the board's mission to protect the public, and are recommending the education rules be pulled from the rulemaking process for further discussions with key stakeholders and to allow staff time to collect and review data. So before I give the staff recommendation, I just wanted to provide a little timeline of what this would mean for the rules. If the board accepts today's staff recommendation, the education rules die. That's terrible. We anticipate bringing back the rules to the September 21st board meeting. If they are approved by the board at that time, the notice of text would be filed on September the 25th. Between October and December, we would have another public comment period to receive both written and verbal comments regarding the rules, with that comment period ending on December 15th. We would then probably have a called meeting of the board to get approval for the next steps. If those were approved, we would submit permanent rules on December the 20th. On January 18th is the Rules Review Committee meeting. So this would in essence mean that the earliest effective date for the education rules would be February 1st of 2024. So I wanted to know if anyone had any questions regarding the process for rulemaking that I can address before I proceed with the staff recommendation. Okay. So at this time, staff is requesting that the board directs staff to stop the rulemaking process for 21 NCAC 360300 approval of nursing programs, collect further data, engage in discussions with key stakeholders, and report back to the full board at the September 2023 board meeting.
Thank you, Angela. So the staff's recommendation is that the board directs staff to stop the rulemaking process for 21 NCAC 36.0300, approval of nursing programs, collect further data, engage in discussion with key stakeholders, and report back to the full board at the September 2023 board meeting. Is there a motion to approve the staff's recommendation? Okay, so I'm going to go with Andrea. The motion has been made by Ms. Andrea Jepson. Is there a second? Okay, so I'm going to go with Ms. Edna Ennis has seconded the motion. Any further discussion? Yes, Frank? Any further discussion?
Does this affect any of the other rules other than the 21 NCAC 36.300? Will the others outside of that be affected as well?
So I can defer to Angela to answer that
So
question.
basically, the rules as they are in the chapter now are in effect. So until we bring these rules back for consideration, we proceed forward as they are published in the code.
Okay, so any of the current changes will not be in effect?
Correct.
Thank you.
Any further discussion? I would just like to thank Dr. Lewis and the other staff, Dr. Ward and Dr. Milner, for all of the research and the time and efforts, and Miss Angela as well, for all of the work that went into this approval, or this discussion, I should say. And I just want the public to also know that we look forward to further review, and I'm saying because I'm chair of that committee, or I was, but we look forward to further review and discussion to make certain that this ends in a win-win for all. If there's no further discussion, I will now call for a vote. All in favor by show of hands. Okay, unanimous, motion carries. Thank you.
Thank you, Madam Chair.
Thank you, Angela. I will now recognize the agenda item M18, which is election of the nominating committee. And so the composition of the nominating committee profile states that there should be 3 members, and we must have at least 1 RN and 1 LPN. So I guess I'm asking for nominations for the nominating committee. And if you have a nomination for the nominating committee, if you will please identify yourself prior to nominating someone for the nomination committee. I feel like I'm like being repetitive. I'm asking for a nomination for the nominating committee. But we do need 3, and at least 1 must be an RN and 1 must be in LPN. And I guess it would probably be great if we could have a little more information about the nominating committee, the purpose of the nominating committee. Sure, who can provide us with that description? Welcome back, Angela.
Thank you. So the nominated committee is responsible for bringing forward a slate of candidates to the September board meeting for chair and vice chair. This committee is pretty much, Chandra does all the work for you. It's a very easy committee, but the committee does receive nominations and present the slate of candidates. I believe, if I'm correct, you maybe have 1 or 2 meetings, which would be virtual. And a timeline will be provided on the work of the committee. The chair would present the report at September board meeting, and the election would be conducted then.
Thank you, Angela. Perfect description. So now that we further understand the role or the roles or the duties of the nominating committee, is there a nomination? Dr. Henderson?
Can I do nominations?
Yes, do nomination.
And can I do a self-nomination?
Self-nomination is allowed.
Hearing that I've worked on this committee before and having worked with Ms. Graves, I would like to self-nominate myself, but I would also like to nominate Arlene Imes.
Okay. So there are 2 nominations. There's Dr. Shakira Henderson, that's 1 RN, and then we have a nomination for Ms. Arlene Imes, that's 1 LPN. And we need, yes, Dr. Steele?
Madam Chair, I would like to nominate Dr. Anna Seaman.
Okay. And so there is a nomination for Dr. Anna Seaman by Dr. Amy Steele. All right. 3. Do I have to decide, do we have to indicate the chair now?
The committee will nominate the chair.
Good, very good. Okay, so do I have a motion to accept Dr. Shakira Henderson, Ms. Arlene Imes, and Dr. Anna Seaman as the 2023 nominating committee members? Okay, so the motion has been made by Dr. LaDonna Thomas. Do I have a second? Okay, Dr. Laura Bartlett has seconded the motion. All in favor by show of hands. And it is almost unanimous, Ms. Ennis. Okay, it is a unanimous vote. So congratulations to you nominating committee, if I got that right. We will now move to the next part of our agenda, which is the motion to adjourn. Is there a motion and a second to adjourn our meeting? Okay, Arlene Imes has made the motion to adjourn. Is there a second? Okay, Ms. Edna Ennis has seconded the motion. All in favor by show of hands? It is unanimous. Our meeting is now adjourned. Thank you.
Amen.